Hi, this is Dr. Nick. I'm here at CES 2020 and at the Digital Health Summit. I'm delighted to be joined by an old friend of mine, Jane Sarasohn-Kahn, who is at Healthy Thinker on Twitter. She's a health economist and she is also a trend weaver.
A trend weaver, yep.
Jane, thanks for joining me.
Thank you, Nick. I'm so delighted to be with you at CES.
I know, CES. We've been here a number of years. You've certainly been coming for a long time.
Yes.
We've seen lots of changes. What do you think the big inflection point has been, if there is one, and where are we going next?
Yeah, I think the takeaway isn't that there are lots of shiny new things, because there really aren't a lot of shiny new things. What there is connectivity between things that generate data. So it's all about intelligence, not just Internet of Things. And in Steve Koenig, the VP of CTA's forecast for consumer tech for 2020, he talked about the last decade being about IoT in terms of Internet of Things, but going forward about intelligence of things, meaning we have all these things now in and outside of healthcare, and now what do we do with the data that are generated? So it's about the services now around the data. So when I say that, it's not just about the wearable tracker or the smart refrigerator or the washing machine, but it's how do we leverage all those the information from those things to tell us about the person who's living that life. Did she open the fridge up several times the day as a proxy for did she eat food?
I think what's really interesting about this is that those insights, and I'm sure the data acquisition is going to increase. We're going to see more data,
Yes.
no question, more devices, all of those things. But we've had a lot of this data. We've just not been able to get to it or analyze it or produce anything. I don't want to say useful. I think there were some useful insights,
Yeah.
but not enough information. That's changing because of AI, because of machine learning. Is that true?
I think that's true, and I think there's a new source of demand, and it's the demand from the person who's starting to understand their data has value. It's a personal asset. So another sort of through line at CES this year is about trust, privacy, and data security. Again, not about shiny new things, but being responsible citizens with the data. And this is a big theme we're seeing in business even, where a lot of businesses like Microsoft is saying, we're going to take on the GDPR, the larger privacy regulation from Europe, and deploy that in much of the world to a higher standard, to be good citizens, good stewards of data. So I think we're seeing this underlying discussion about how to be responsible in the post-Cambridge Analytica Facebook era, and that really impacts healthcare profoundly.
And I think if you haven't seen the whole debacle of this use of data, essentially weaponized.
Yes.
You need to, but for those of us that have, we've all, I think, come to this shocking realization that it's essentially being used against us.
Yeah.
And yet we need data. Without data, we have no health insights.
That's right.
So we have to find this middle ground. What's that? How do you thread that needle?
I think, at least in the US, there's a value exchange story, which is if I'm going to share data with you, I want something back in return. And it's not just convenient ads that know that I want to eat something fast food or go to a particular movie. An example of that comes out of the interview I just did with Roy Jacobs of Philips, where in their new program for oral health, they're collaborating with Delta Dental. And it's not just that Delta Dental wants you as a member to share your data, but there's a behavioral economic tail, which is you will get free brush heads and extra advice coming out of that. And that has real value to people. Oral health is important to overall health, but there's an exchange well beyond the fact that you're getting ads that mean something to you.
And I think what's important there is it's those incremental steps, it's the nudges that we all need, because I know we don't get up in the morning going, how can I, destroy my teeth, destroy my health?
Right.
But things happen. We're built, essentially, I don't want to say misbehave, but certainly aggregate towards poor health.
Yeah. Well, in many countries, of course, public policy plays a role in food and nutrition quality, and air and water quality. And in the U.S., sadly, if you live in Flint and you're a little kid, you're pretty screwed in the waterfront. And yet that's a public health issue. And we're in an era, and this is a short term, I think it will swing back, but we're seeing the private sector, the Walmarts of the world, the CVS Healths of the world. In the former case, Walmart saying we're going to quit lethal bullets. In the case of CVS, we're going to quit tobacco. Private sector are taking on public health roles because right now, public health is largely being eroded, and that's a political thing, and that's the world we're living in now. So we're seeing big business taking on amazing public health roles and hats.
Fantastic. So I think, the good news here is that the public piece of this is being taken over by the private sector that's seeing a need to sort of step in. That's just delightful to hear.
Yes.
I think it's an essential part of our future. We have to stay absolutely on top of it, thinking about it and making sure that our health evolves appropriately.
That's right, with those privacy and security standards that are direly in need of updating.
Fantastic. Well, Jane, just remains for me to promote your book, Health Consuming. If you haven't read it, you should.
Thanks.
And to thank you for joining me.
A pleasure, Dr. Nick.
This is Dr. Nick. I'm here at CES 2020 at the Digital Health Summit.